Topic is hypertrophic scar. Hello dear students, we will discuss a topic which is quite common. We will face it in day-to-day surgical practice. What is this condition is? Look at that. See that? Scar is there from old, maybe burn, maybe trauma is there. See that? This is hypertrophic scar. That's two entities, normal scar, matured one, then keloid, which is continue to grow, and hypertrophy continue to grow till 6 months. So the difference between hypertrophic scar and keloid. Keloid is claw-like, it's aggressive, more aggressive. It's excessive formation of abnormal scar tissue that can occur anywhere in the body, not generally predisposed, contains mainly type 3 collagen. So it's raised, often vascular, confined to the margins, very important, confined to the margins of the original wound, never goes beyond that. Pale brown, not color, not painful, non-tender. Unlike keloid is painful, often tender. It goes beyond the actual margin, normal tissue also, it's vascular also. This is not that vascular, only little vascularity, and eventually it may regress after 6 months. It goes only up to the 6 months. There is a point, spontaneous regression can occur over time in this, but it does not occur in keloid. It's common in deep dermal burns, wounds sealed with secondary intention, wounds crossing tension lines. Secondary intention, wounds crossing the tension lines. These are the different features of the hypertrophic scar. So you should know differentiation between the differential in the keloid. Treatment respond to steroid injection actually, this patient. You can give steroid and you can excite it, you can put this suturing, you can put a graft, continue to give steroid, that may be helpful. Keloid is much more aggressive, much more problematic than hypertrophic scar because it keep on growing beyond 6 months also continue, forever actually many times. Even if you excite it may recur. It's a vascular one, progressive one, but it's not malignancy, remember. So you should know the differences between the keloid and hypertrophic scar, which you can always go through my manual of surgery wound chapter. Type of collagen in the hypertrophic scar is mainly type 1, mainly type 3, type 1 and type 3 equal position, no collagen. Student, put the answer in the comment box. I will get you back later. So students, go through my SRB's clinical methods in surgery, which has got a video lectures of each topic. So many topics are covered, every topic as far as CBM syllabus is covered. How to examine the patient, swelling, ulcer, arterial disease, venous disease, thyroid, breast lump, mass abdomen, briefly orthopedic, every system, whatever your required thing, everything is covered. There is a video of how to examine of each topic, and principles of examination is good, and differential diagnosis in a table format is given, and briefly investigations. Of course, treatment is not a topic will be covered in a clinical method examination, remember, and many photos of the most of the conditions with the illustrations. Photos will tell the clear idea about for the students how exactly condition looks like. So covers everything with the beautiful photos, and it also gives the instruments, specimens, then operative surgery briefly. Everything is covered. Small images also it is covered. So it is more than sufficient for all undergraduate, postgraduates of any system to learn. Very basic required thing for the surgical field is clinical methods. So please go through that and purchase that and make use of it. My SRB manual of surgery is very popular. It covers theoretical aspect, everything, principles, treatment in detail, briefly technical aspect, and with the photos, illustrations, quotations, all topics with the specialty, urology, cardiothoracic, neurosurgery, and operative surgery instruments. Again, it is covered in this book also. Every quotations, and you should worldwide also, actually including our country, everywhere. And please, you can make use of it. My operative surgery book, SRB's operative surgery atlas, that is a 2-volume book, covers in detail operative technique of surgery, all surgery, small surgery, major surgery, everything with around more than 10,000 illustrations and photos. It gives very good principles and technical, step-by-step technical aspect. Very useful for postgraduates. Not much useful for undergraduate, but it's a postgraduate book and consultant book and learner after MS. It gives everything. You can, before going to surgery, you can always read this book. Memorize your steps and do the surgery properly. Every topic, general surgery, gastroenterology is covered in detail, step-by-step with illustrations. And my SRB's atlas of tissue approach, small book atlas, 100 pages. How to do the suturing, tissue approximation, including laparoscopic suturing with the video. it is covered. So any basic learners, suturing is very, very important surgical field as a skill actually. Dissection and suturing, so the two parts of the surgical skill. So that is also covered very well with videos. You can always go through that. And my website, please subscribe, all of you. If your daily lectures are there, live sessions are there. My Diginour lectures through JP Publishers, around 220 hour lectures. Entire thing as for CBM is covered with the examination part, with all topics of CBME, ulcer to operative surgery, instruments, specimens, examination, specialties, basic, everything is covered. You can always purchase for 1 year and have a clear idea about the surgical topics, understand very well and helpful for your exam, neet, MCQs. Also, it is there both in manual and my lectures. So students, I hope you have understood this lecture very well. Thank you very much.